Welcome back to the deep dive. Sometimes the things most vital for our health are just ticking away in the background. We don't really notice them until maybe something goes wrong.
Exactly.
Today we're focusing on one of those, vitamin B12 blood testing. It seems simple, but we've got this great local guide from Derby that really highlights how crucial it is. Okay, let's unpack this.
Yeah, what's fascinating here is not just that B12 is important, but how often a lack of it is kind of a hidden reason for feeling tired or having neurological issues. It gets missed a lot.
Right.
I mean, it's fundamental. You need it for your nervous system to work properly, for making red blood cells, even for building DNA, the basic blueprint for your cells.
So it really fuels so much, from cellular metabolism, how you get energy from food, to making new cells. What are the early warnings then, the subtle stuff?
You might feel this fatigue that just doesn't shift, no matter how much rest you get. Or maybe weakness, or that odd pins and needles feeling, usually in your hands or feet.
That tingling.
Yeah. And if it goes on long term, untreated, you could be looking at quite serious things like pernicious anemia. That's where your body actually attacks the cells needed to absorb B12, or even cognitive problems that might not reverse.
Okay, that's definitely significant. So if someone's hearing this, maybe thinking, that sounds like me, how do they actually get tested? Is it a big hassle?
Oh, no, thankfully it's really straightforward. It's just a small blood sample, usually taken from a vein in your arm. Then it goes off to the lab.
Simple enough.
Pretty simple. Usually no special prep needed, although some places might ask you to fast for maybe 4 to 6 hours beforehand. Worth checking. And results, usually back in a few days.
That's good to know. So beyond people with those obvious symptoms, who else should be thinking about this test?
Well, definitely older adults. Our ability to absorb B12 can decrease as we age. Vegans and strict vegetarians too, because the main sources are animal products.
Right, that makes sense.
And anyone with gut issues, like Crohn's disease, or maybe they've had stomach surgery, even some medications can interfere with absorption. And thinking about Derby specifically, dietary habits, maybe more plant-based eating or processed foods, can sometimes mean people aren't getting enough naturally.
That's a really practical point about local context. Okay, so the results come back. What are we actually looking at? Is there a good number?
There is. The standard normal range is usually cited as something like 190 to 950 picograms per milliliter. But, and this is important, many health professionals, like Dr. Sarah Betts, a GP mentioned in the Derby Guide, suggest that for feeling really well, for optimal brain health and energy, you probably want to be above 400.
So normal isn't necessarily optimal.
Exactly. It's the difference between just scraping by and actually thriving. If your levels are low, that's the conversation started with your doctor about diet, maybe supplements, or figuring out why they're low. Even high levels, though less common, can sometimes point to other things needing a look.
That normal versus optimal point is key. Here's where it gets really interesting. Did the guide mention any specific stories, maybe from Derby, that show the impact?
Yes, Dr. Betts shared a really telling example. She saw many patients just wiped out, feeling exhausted, and it turned out to be undiagnosed B12 deficiency. She mentioned a 65-year-old patient specifically whose fatigue and memory fog lifted dramatically after treatment.
Wow.
And another expert, consultant nutritionist Mark Turner, really stressed the prevention side, especially, again, considering local dietary patterns in Derby. Getting enough B12 helps prevent anemia, sharpens your thinking, keeps memory strong, and can even stabilize mood, potentially lowering risks for depression or anxiety. Finding it early stops those really serious long-term problems, like nerve damage you can't fix.
It's amazing how wide-ranging the effects are. So practically speaking, what can you do to keep your B12 levels healthy?
Food first, usually. Animal products are the main hitters. Meat, particularly organ meats if you eat them, liver is packed with it. Fish like salmon, tuna, eggs, dairy like milk, cheese, yogurt.
And for vegans or vegetarians?
Fortified foods are your friend. Lots of plant-based milks and breakfast cereals have B12 added. Nutritional yeast is another good one. And supplements can be really useful, especially for those at-risk groups. But definitely chat with your doctor or a health professional about the right dose for you.
Right, don't just guess.
Exactly. And how often to check. Generally, an annual test is a good idea for many. But if you're in a high-risk group or have symptoms, you might need it checked more often.
Okay. And for listeners in the Derby area, where can they actually go?
The guide mentioned some reliable options like the Royal Derby Hospital, Sinai Medical Center, and Derby Health Center. We'll pop contact details in the show notes.
Great.
There are even private nurses who can come to your home sometimes. Best bet is always to call ahead, check their process, appointments and stuff.
Perfect. So, what does this all mean for you listening right now? Well, getting a handle on your vitamin B12 status isn't just about a test result. It could genuinely change how you feel every single day, your energy, your clarity, your overall quality of life.
Yeah, if we connect this to the bigger picture, knowing your levels lets you be proactive. You can catch potential issues early before they become major problems. It's about having the energy and focus to actually do the things you enjoy, connect with people, and just live a fuller life.
So maybe the final thought to leave you with is this. How might a deeper understanding of your own unique nutritional needs transform your daily energy and cognitive clarity?